sometimes the different branches of the nervous system are basically out of balance. So the fight or flight fires all the time and readily because people maybe in their childhood didn't feel safe or they had some other trauma. And then the rest and digest, because it's not being used so much because the brain is on red alert looking for threats all the time due to that trauma, that causes basically an imbalance within the autonomic nervous system. And then so over time, this imbalance can lead to the different dysfunction of the different organs because that the signals are just not traveling back and forth the way they're supposed to. But what can also happen is that the dysfunction within the vagus nerve could be coming from the dysfunction within certain organs, and that could be affecting the vagus nerve. So as much as a poor vagus function can create chronic inflammation, if we have chronic inflammation because of maybe eating a lot of toxic foods, we can affect the vagus nerve function. Similarly, obviously, if there is something external, for instance, that affects the gut, that can have a negative impact on the vagus nerve function. But again, flipping it round again, if we have issues sort of in the brain or at the mental emotional level or neurological level, again, that can affect vagus nerve. So this is worth bearing in mind that because of this back and forth communication, everything affects everything else, and it can end up being this spiral because it starts obviously somewhere, wherever it is, whether it's toxicity or trauma or circadian rhythm issues, right? It starts somewhere, but then it starts winding itself up. And you cause more dysfunction, and then that causes more dysfunction within the organs, and then that breaks down the gut, and that causes more dysfunction within the nervous system and the brain, and so on. So sometimes people can really end up, and obviously people who have had chronic symptoms for a long time are often in this exact situation where it's literally that spiral, isn't it? But of course, yes, some other factors I did mention, circadian rhythms. That's obviously going to be a huge one. Toxicity of any kind, inflammation of any kind, that sort of thing. Yeah, so there's quite a few physical factors, but the emotional piece is often what people A, overlook, and B, it's basically a more elusive piece for a lot of people. And because of that, they tend to maybe shy away from it. They don't have enough self-awareness. They don't really want to, maybe because of fear or other issues, really fully understand it. But definitely what can happen is if we have all this sort of background noise, or what I call emotional toxicity, that will be contributing at that sort of level where the person may not have full conscious awareness that background chatter is causing them a lot of issues. But because it's always there, that actually puts stress and activates fight or flight. It puts stress on the nervous system, it activates fight or flight. So even if somebody's got this constant, for instance, negative self-talk, or something like that, or they have chronic anxieties and things like that, will certainly, that to the body is still chronic stress. And anything that is chronic stress will sooner or later contribute to this nervous system dysregulation and essentially a breakdown of the body over time. So when we're thinking about chronic stress, obviously there is the mental, emotional, but obviously we know toxins are chronic stress, biological agents are chronic stress if they're in the body over a long period of time, like people fighting lots of different infections, things like that. That all is activating to the nervous system. So to the nervous system, the stress essentially, it will activate the fight or flight the same way. And so, like I said before, it keeps strengthening that side of the nervous system, and the other side just gets weaker and more pathetic, and basically, and it's not engaging readily enough when it needs to engage. And the crux of all of this is that we're supposed to be spending most of our time, like 90% of that time, in this rest and digest activation, in this ventral vagus activation, and only occasionally activate fight or flight. But of course, for most people these days, it's the exact opposite. And that's where we have this, where we see all of this, all of these issues, and we see so many people breaking down and having this nervous system dysregulation issue. That's the reason why, because what's happening is we've sort of flipped it, and now we're spending most of our days in fight or flight or freeze even, and not activating that rest and digest readily enough and frequently enough, often enough.